Hello everyone, welcome back to Medseekers. In today's video, we are going to do a detailed analysis of CUET PG Masters in Public Health Entrance Exam Question Paper of 2025, specifically 19th March Shift 3 analysis, and based on that we'll discuss the latest syllabus for CUET PG MPH 2026, how should student prepare for CUET PG exam, and the best book list. This is the outline of today's video. So in 2025 also they followed a similar pattern, 75 MCQs. It's an online entrance exam for 300 marks. If we look at CUET 2025 Masters in Public Health question paper, see, I'll tell you according to syllabus so that it will help you in your preparation strategy. From basic microbiology, biochemistry, biotechnology, there are 6 questions asked. I'll tell you from which concepts they have asked also. We'll discuss in further parts of this video. From preventive and social medicine, there are 69 questions. See, all this from epidemiology to environmental sciences, epidemiology, social science, food and nutrition, communicable, non-communicable diseases, public health and epidemiology, biostats, environmental sciences. All these topics belongs to preventive and social medicine. From this particular part of your syllabus, there are 69 questions. So please don't ignore preventive and social medicine. If you ignore this part of your syllabus, it will be very difficult to crack the entrance exam because majority of your questions are from preventive and social medicine. So please prepare accordingly and make your foundations very strong. As I mentioned, from basic microbiology, biochemistry, biotechnology, total there are 6 questions from 2025 question paper. They have asked regarding what is role of reverse transcriptase in recombinant DNA technology. They have asked questions regarding point mutations. They have asked questions regarding non-enzymes responsible for relieving supercoiling during DNA replication. What is the purpose of using T4 DNA ligase in recombinant DNA technology? And few questions were asked regarding what is role of ATP in bioluminescence reaction, and one question was asked regarding amino acids. So when you are preparing, see, suppose if you are preparing what is point mutation, you will get an answer. Apart from that, read about what is nonsense mutation, what is silence mutation, what is frame shift mutation. Make sure you cover the entire topic. Same questions don't repeat, but concepts do repeat in many entrance exam, not only in CUET PG. So when you are solving PYQs, solve it in a very smart way and make sure you master the concept. So there are 69 questions from preventive and social medicine. Preventive and social medicine syllabus starts from epidemiology till environmental sciences. So I will briefly tell you about what concepts they have asked from this particular part of syllabus so that it will help you in your preparation. If you want all the 75 questions, see, for example, if they have asked question regarding committees, we will solve the question and we will explain the concept of all the committees in detail. If you want such kind of videos, please do comment below and like this video so that we will know many students are interested in this particular concepts. We'll soon plan such kind of videos for you. So from preventive and social medicine, there were many questions regarding committees. Bohr committee, Mudaliar committee, 2 questions were asked regarding committees, and there are good number of questions from communicable and non-communicable diseases. From nutrition also they have asked good number of questions. Glycemic index, what is hidden hunger, vitamins and their deficiencies, what is food fortification. Vitamins and deficiencies is NTA's most favorite topic, not only in CUET PG, other exams which NTA takes. In every paper, almost 85 to 90% they will definitely ask questions regarding vitamins and deficiencies. There were many questions regarding mosquitoes, larval measures, food fortification, public health acts like ESI Act, Workman Compensation Act, and they were asked regarding what scales to measure socio-economic status. National immunization schedule is also there, one of most favorite topic. Vaccines and national immunization schedule, vaccines, make sure you study this particular concept in detail in a perfect way. And integrated management childhood classification, IMNCI, is also one of their most favorite topic. And questions were asked in 2025 regarding to World Health Organization BMI classification. I mean the values. What is the pre-obese value for WHO BMI classification? There were questions regarding sputum pulmonary TB, what are risk factors for NCD, and they have given matching related to what is live attenuated vaccine, what is toxoid vaccine. Suppose for example BCG is live attenuated or toxoid, like that they have asked. And regarding HIV also there are good number of questions. Lab diagnosis of HIV they have asked, and one question is related to neonatal tetanus, and the other question is related to study designs. In epidemiology section, every student must study this concept called study designs. This is really very important topic, not only for this exam, for any public health entrance exams. Study designs are really very important. You have to know what is case control study, what is cohort study, what is cross sectional study, what is ecological study, what is ecological fallacy, what is RCT, what are different types of blinding, what is blinding. All these concepts are really core concepts of epidemiology. You must study these concepts, and there are some questions regarding what is incidence, what is prevalence, and investigation of an epidemic is most commonly repeated concepts in all the PYQs. Make sure you study all the steps also. And there are questions related to what is mortality indicator, what is morbidity indicator. Screening is one of NTA's most favorite concepts. There are almost 2 to 3 questions from screening chapter. You have to know screening. What is screening? What is the criteria for screening? What is positive predictive value? What is false positive? What is true negative? Basics of screening is really very important. You have to study what is sensitivity, what is specificity, PPV, NPV. All these concepts in screening is a must study topic for all the students. They have given matching of certain terms and you have to match it. They have asked what is isolation, what is quarantine, what is elimination, what is eradication. Then they have given description, you have to match it. And many times they do ask what is endemic, what is epidemic, what is pandemic. These are really important concepts in epidemiology. And there are good number of questions related to TB also. They have asked regarding National Health Program for Control of TB. There are questions related to contraceptive methods. What is sex ratio? What is Pearl index? What is odds ratio? What is population attributable risk? What is relative risk? All these concepts of odds ratio, population attributable risk, relative risk will be covered in epidemiology section. When you study designs in cohort study, they will describe in detail about what is population attributable risk, what is relative risk, and which study design will calculate odds ratio, which study design will calculate relative risk. All this you have to know. And there are questions related to biomedical waste management, and from biostats also there are good number of questions. What is coefficient of correlation, what are measures of central tendency, and regarding sampling methods also there are good number of questions. And mosquitoes are really important. You have to know what diseases Aedes mosquitoes cause, what diseases Culex mosquitoes cause, what is their larva, in which water they do breed. All these are really important. Study mosquitoes and their larval measures in detail. Don't miss any mosquito. And in Plasmodium also read about all the different species, Plasmodium falciparum, Plasmodium ovale. All these concepts you should know in detail. And there are questions related to sampling methods also. When you study sampling methods, study what is probability sampling, what is non-probability sampling, which sampling methods comes under probability sampling. Read in such a way that if somebody asks you what is simple random, what is systematic random sampling method, you have to tell them in a clear way, so that then only you can answer NTA level questions. They will test your basic knowledge. Don't miss sampling methods. Read this particular concept in detail. In sampling methods you have to know probability sampling, non-probability sampling, what is simple random, what is systematic random, what is judgmental sampling, what is snowball sampling, what is convenience sampling, what is quota sampling. All these concepts should be covered. So far I told you about all the 2025 most commonly asked questions, concepts in detail. So let's solve few 2025 questions, then you will get an idea how to study while solving PYQs. Let me take this question as an example. Here you can see they have given matching disease of infection and causative agent. So many of you know malaria is caused by Plasmodium, syphilis is Treponema palladium, anthrax is Bacillus anthrax, plague is Yersinia pestis. After matching, after your question is solved, don't leave this question. Let me take you example. Let's take malaria as an example. When you are studying for any competitive exam, how should you study and solve PYQs? So when you are studying malaria, you have to know malaria is a protozoal disease caused by Plasmodium species, and it is transmitted by the bite of infected female Anopheles mosquito, and you have to know their species also. We have Plasmodium vivax, Plasmodium falciparum, Plasmodium malaria, Plasmodium ovale, and human is the only reservoir. What is the source of infection? It's an infected human blood. What is their mode of transmission for malaria? What is incubation period for malaria? Who are affected due to malaria? What are the most commonly affected places? All the clinical features you have to know. Lab diagnosis is really very important. Peripheral blood smear is a gold standard test for malaria. All this you have to know. And what is the treatment? Sometimes they do ask what is primaquinine used for, which species. All this you have to know. And most commonly asked question is anti-larval measures, anti-adult measures. And regarding national health programs also, Indian government has certain programs for malaria, that also you should know. And we have national framework for malaria elimination. We have malaria elimination target by 2030. All these concepts you should know. Not only for malaria, you have to do similar way for syphilis, anthrax, plague, so that you will have a mastery of this particular concept. This is another beautiful example for when you study previous year question papers topic in detail, how it will help you. These two questions are from 2025 exam only. In this question they have asked, you have to arrange causative agent as per their incubation period in an ascending order. Suppose when you are studying Salmonella typhi, if you study in detail about what is Salmonella typhi, it is bacterial disease, viral disease, what is typhoid period incubation, what is lab diagnosis of typhoid in detail. If you know this concept, look at this question, 15th question. They have asked, is salmonellosis a bacterial disease or a viral disease? If you don't know what is salmonella, how will you answer this question? That's the reason I am telling you, when you study for national level entrance exams, solving PYQs and mastering those concepts are really important. This is also 2025 question only. Levels of prevention is really very important. You have to know what is primordial level of prevention and examples. Sometimes they'll give you an example and they'll ask you which level of prevention is this. See, in primordial level of prevention, we are trying to prevent risk factor itself. In primary level of prevention, risk factor is present. We are trying to prevent disease. In secondary level of prevention, disease is already present. We are trying to detect it through screening. In tertiary level, we are doing rehabilitation. When you study about levels of prevention, please study this concept in detail and do some basic research and understand examples. When do we do primordial level of prevention, so that you will never forget what is primary level of prevention, what is secondary level of prevention, what is tertiary level of prevention also. In KPAC textbook and PSM by Dr. Vivek Jain, I have given good examples also. So this is also 2025 question only. I have already mentioned to you, they have asked regarding committees. 2 or 3 questions they have in 2025 question paper is from committees concept only. So make sure you master all the health planning committees. There is a dedicated video in Medseekers channel. You just type health planning committees Medseekers, you will get the video. Make sure you write it down and practice it. Master this concept of committees. You have to know what is Bohr committee, which sometimes they'll ask you 3 million plan was introduced by which committee. Mudaliar committee is also called as. What did Chedda committee recommend? What did Mukherjee committee recommend? All this you have to know in detail. Which committee proposed multi-purpose worker scheme? What did Kartar Singh committee do? They will ask you MCQs, or else sometimes they'll give you statement, sometimes they'll give you matching. So you have to know all the committees and their suggestions in detail. Don't miss this particular committee's video. Many students have commented regarding which book should they refer for CUET PG MPH entrance exam 2026. I have mentioned you so many times, KPAC textbook is just like a Bible for preventive and social medicine. Some students have commented which version to buy, which edition to buy. See, any edition works, but in the latest edition you do have all the updates. But if you have old edition also, that's also no problem. Just for few concepts you don't have to buy a new book. PSM by Dr. Vivek Jain is really a good book in your entrance exam point of view, but make sure you buy a right version of PSM by Dr. Vivek Jain, because there are two variants of PSM by Dr. Vivek Jain book. One book includes biostats, one book doesn't include biostats. For CUET, PG, MPH or any other MPH entrance exam, you should buy a book which includes PSM by Dr. Vivek Jain including biostats, because biostats is a part of your entrance exam syllabus. If so far this video is helpful for you, please do like the video. If so far this video was helpful to you, please do like the video and share it with your friends who are preparing for CUET PG Masters in Public Health entrance exam. We have an Instagram account and WhatsApp channel also, where we post all the latest updates and notifications. If you are interested, do follow. If you have any other comments or queries regarding CUET PG MPH preparation, do comment it. Thank you for watching. Please do subscribe to the channel.